First of all, I'd like to thank you guys for having me here. I'm very excited to be here. Just to give you a little bit about myself, I'm a doctor of chiropractic. I'm originally from Jefferson. I got my chiropractic degree from New York Chiropractic College. That's up in wine country, in between Syracuse and Rochester in New York. So very, very happy to be here. What I want to talk to you guys today about is health. Okay, because that's one thing that we all kind of have to face in our time, whether it be maybe some diabetes, which is kind of getting out of control with our people's lifestyle nowadays, and with sugar being prevalent in our foods and that sort of thing. So that's one of the things that I try to combat with my patients in order to get them healthy. So I'm a chiropractor by trade. I have some advanced degrees in neurology, kinesiology, nutrition, and acupuncture. So I do a little bit of everything when it comes to helping patients get better. One of the things I've had trouble with, no matter how much nutrition we've done, no matter how much physical therapy we've done, to help patients with osteoarthritis and degenerative joint conditions, because it seems like as much as you can prolong that, it's a process that continues to plague people, knees, shoulders, that sort of thing, hips, where we just kind of wear out over time. So one of the exciting frontiers, the state-of-the-art practices that we're actually bringing to Jefferson is regenerative therapy using stem cells. Okay, has anybody heard of stem cell therapy before? It's kind of a hot topic. But stem cells are amazing, the capabilities that they can do. Just to give you an overview, the tissue bank that we use is called New Life Regenerative Medicine. And what they do prior to a birth, they get a contract with the patients. They write up a contract that they're going to donate the stem cells of the umbilical cord and some of the tissues from the birth. There has to be a healthy cesarean section. If something goes wrong at any point in time, they discard the tissue. Okay, what they do, once they retrieve that tissue, they go through and freeze it, like you do, like your ovaries or eggs. People that freeze their eggs, that sort of thing. They send it off to the lab and they put it into a solution. They turn that actually into an injectable, which we can use for orthopedic cases like bad knees and bad hips, stuff like that. The stem cells are pretty amazing because what they do is actually go through and restructure the joint surfaces and actually reproduce the cartilage and rebuilds the joints to help stop the process of degeneration, okay? Ultimately, as an alternative to joint replacement, okay? Because we want to try to obviously avoid surgery as much as we possibly can. So this is one of the things that we're going to be using to help combat that. Now, I learned about stem cells about 2015. Well, don't get me wrong, I've heard about stem cells, but my personal story with stem cells is back in 2015, a friend's sister from Jefferson was diagnosed with leukemia. So there is an international program called BeTheMatch.com that does DNA testing to figure out if anybody is a match for their cancer treatment. So our whole town rallied around. They had about 350 people come out, and everybody went through and did the swab. I was like, this is great. She's going to find a cure, and everything will be perfect. Well, unfortunately, there wasn't a match at all in our little town or the world. Okay, within their database. And unfortunately, she died. But during that process, I was contacted by Be The Match because there is a gentleman who's in his 50s in Minnesota who was suffering from leukemia, and he was in a second remission. So they contacted me and said, hey, you're a possible match for this guy. Would you be willing to go through the steps and procedures to find out if you are a match for this guy? I said, absolutely, anything I could, that's why I signed up, So we were a perfect 8 out of 8 match, which is 1 in 10 million.
Wow. So this is your brother?
Right? That's what they said. They said there's some sort of link, down. But anyway, it is. It's kind of crazy. So anyway, they said, would you be willing to donate your stem cells? Because stem cells help beat cancer. I thought, that's kind of amazing. that out as far as fast forwarding, that's one of the reasons why cancer becomes more prevalent as we age, because we actually lose stem cells. Stem cells actually tag cancer cells and kill them, or at least sets forward the process to kill them. So the thing is, when we're skeletal maturity, we've already used 90% of our stem cells. We have 10% left to live off the rest of our years. It's kind of like repository. So degenerative conditions, chronic conditions occur when we don't have enough stem cells to fix ourselves, rebuild our joints, that sort of thing. If you're a smoker, all your stem cells are in your lungs. If you're a drinker, all your stem cells are in your liver, trying to keep you alive. Okay, that's the way they work, okay? They're mobile, they go anywhere that your body needs them. Okay, if you have degenerative knee, they're gonna try to rebuild the cartilage in your knee as much as possible until you run out of enough stem cells. So, knowing now how much stem cells cost, I went back and did the math to find out they took 2 pints of stem cells from me.
Where do they get them from?
Well, there's a couple different places. You can get them from fat, you can get them from bone marrow, or you can get them from umbilical cords. Okay? For me, we did a process called apheresis, okay, which basically they pulled out my blood, spun it down, then took the stem cells, and then put the rest back into me. So after adding all this up, I looked at my donation, and my donation to this gentleman I didn't know was $662,200 for somebody I didn't know to save their life. And I would do it again in a minute. The biggest thing is, though, that took all my stem cells.
Right.
So, do you think my knee is going to wear out faster than somebody else? Do you think the probability of cancer is going to be higher than me than other people? I guarantee you. But, again, I would do it again in a moment. So, fast forward now that we know that the capabilities of these stem cells, looking into different diseases such as Alzheimer's, dementia, other degenerative conditions, those are neurologic degenerative conditions, you can use stem cells to rehab and stuff like that. Basically, stem cell is a blank cell. Okay, it's an immature cell. The neat thing about that aspect is there isn't a rejection because there's no blood type to it. Okay, it's just an immature cell. That's why they can use these cells on different patients without having to figure out what their blood type is, on anti-rejection, that sort of thing. So, why would you want to pick a stem cell regenerative therapy over an actual surgery? Okay, like you need your knee replaced. All right, well, let's think about this for a second. Not many people I know want drugs, as far as I need to stay on pain medications my whole life to deal with this. Surgery, obviously, there's lots of risks involved. All it is a joint amputation when you think about a replacement. Okay, and I don't know if you guys ever seen a joint replacement or anything that they do. It's pretty brutal. Luckily, you're out, but the downtime, okay, there isn't a downtime with stem cell therapy. You don't have to do weeks or months of physical therapy, okay? It's just an outpatient procedure. So there's a lot of risk with surgery, not a lot of risk with stem cells. Do stem cells work as good or better than a joint replacement? Well, the old adage, nothing is as good as the original. Okay? A lot of people get joint replacements and they do fine. A lot of people get joint replacements and they do not do fine. Quick story, I was explaining to one of my patients that we were going to have this as an option in our office, and she got really excited about it. And I was like, do you know something about stem cell therapy? She's like, well, let me just tell you a quick story. My husband, he needed both his knees replaced. They looked at stem cell therapy as an option, but they were like, it's really expensive. And I was like, I understand that, it is pretty pricey. And then she said, so we opted to go with the surgery for his first knee that they did. And she said it was a nightmare. He had infection, he got MRSA, they had to take the joint out and replace it. He had to be in the hospital, he had to be on medication for a long time. He had to go through months of physical therapy. Nothing really helped, it was trashed. He didn't regain any sort of mobility, any sort of strength, his knee was ruined. So, knowing the other one needed to get done, they opted to do stem cell therapy. And she said that after about 3 months, he had 100% relief of the pain. He was able to do anything he wanted to with that knee, and that they wish that they would have done that with the other knee. And I was like, well, I understand, but the price. She's like, no, you don't understand. The cost of this surgery and all the complications that came from it was 10 times what it cost for the simple injection. So I thought I needed to hear that story because a lot of people say, well, you know, stem cells aren't covered under insurance and that sort of thing. And I understand that, but when you look at the no downtime, not a long need for physical therapy, and just the, you know, limited chance of infection, no more than a flu shot, I know for myself that would be the first option I would look at to try to either prolong or obviously avoid surgery. So I think it's really important for us to realize all the options that are out there, you know, before we make huge decisions like joint replacement. So I think that's just important for all of us to realize that, you know, this sort of therapy is here now, and you know, it really just comes down to quality of life. I mean, we're all going to get to that point in our life where we're not going to be able to do what we want to be able to do. We're not going to be able to enjoy every day, get out there and ride the bike or go for a walk, or, you know, and so to be able to have something using the miracle of life to give you a miracle to be able to get out and do what you want. I mean, I think that's just kind of the bottom line. You know, we're all about, you know, trying to make your life better, trying to just give you the freedom that, you know, I mean, don't have to just, you know, mope around all day, you know, and kind of give you your life back. So that's, you know, that's kind of the tenet of what I want to discuss with regenerative therapy. In front of you, I put out a pain and health survey. If you guys would like, you can fill that out. It would give me some information if this is something that, you know, you'd be interested in. Now, we do a lot of things at our office. I just want to bring that to your attention because it's one of the best things that we do. We also do weight loss, okay? Because inflammation, pain, and weight are all important as far as trying to get all of that out of patients to feel better. So we do a lot of weight loss, we do chiropractic therapy, neuropathy. People have neuropathy, pain in their feet, that sort of thing, makes it difficult for them to walk, move, burning, numbness, tingling, that sort of thing. So I have a whole neuropathy wing of our office that we use to help patients combat neuropathy. You can also use stem cells for neuropathy. We're doing injections into the feet to help the nerves regenerate. Okay, so that's an option too for patients that do have neuropathy. I'm really excited about all the opportunities that we can do with stem cells as far as anti-cancer, anti-aging, even stuff like hair restoration. People use it for aesthetics, erectile dysfunction, anything like that. Stem cells have been shown to help combat and fix. Okay. Does anybody have any